a little bit.
As we age, our bones and joints simply wear out, but advances in orthopedic surgery to help us are constantly evolving. Dr. Ed Stolarski is here with some new trends in orthopedic procedures. Welcome. Good to see you again.
Thank you.
Yes, it is. My favorite man in the world. There have been a lot of men in my life, but he did more to make me happy.
Well, can we please explain this? Okay, yes.
I wish all women would say that.
He did my hip replacement, and I've never had a pain since then.
That's a blessing.
Well, let's talk about new trends, because now Linda was in the hospital, I'm assuming for what, a day?
2 or 3 days.
2 or 3 days.
Uh-huh.
But you have told us that the new advances are making different types of procedures possible outpatient.
Yeah, I brought a lot of stuff here, but really it's to bring you up to date on outpatient total joints. What does that mean? You're going to have your joint done in the morning and you're home for dinner.
Wow.
It doesn't mean we're going to do Linda right here. We're going to do it at a real
She
center.
actually thought about it. That's why she was being nice.
Though?
Well, what makes it possible? The technologies that we have now, it's much less invasive. I mean, think about some of the crazy surgeries that were done outpatient long before total joints. Much more difficult surgeries, much more complicated surgeries. Oh, wow. You're not sick when you have a total joint. You just have a bad hip or knee.
Right.
So replace it and get you on your way. So the things that have allowed us to do this are the anesthesia techniques. So we're doing better with pain control and soft tissue swelling and invasiveness. As of January of 2018, Medicare is going to allow outpatient total knees in Medicare age patients, because previously it was all non-Medicare. And that's just a big jump. It's going to help cost. It's going to reduce infection. Every Thursday we're now doing outpatient total joints. No readmissions, no infections, everybody happy.
Well, what makes this possible? Because I think about a surgery in a knee or whatever, or hip, it seems like it's a lot of work.
It is, but a lot of it, like the gentleman was earlier with the violin, it's an art, it's like a dance. You go through the steps sequentially and safely, and on the other side is a perfect total knee. So really, how do you do it? Appropriate anesthesia, soft tissue techniques that are less invasive, and instruments that allow us to put this implant in appropriately.
Let's talk about the instruments, because you have the what they used to be and the what they are nows here. So explain the difference.
It's such a huge difference. So this big pile of trays, I'll do 10 to 15 joints in a day. I need that many trays for every single knee.
Really?
They have to be sterilized. How do I know if they're sterilized properly? How do I know if they're contaminated by a gnat? I'm just saying the place, you know what I'm saying?
Right.
I mean,
No, we
I just have no
understand.
control.
There's a margin of error.
Yeah, so now we're bringing in these trays right here in front of me, replace all those trays. Now and this doesn't have to go reprocessed. These get open, they come in sterile, sealed. We open them, place them on the table, and we do the total knee. You know, people that worry about stuff being thrown around, these have a zero carbon footprint or whatever, so you don't have to worry about the trash, and we don't have to re-sterilize. Those are about $100,000, that set of trays.
Wow.
Yeah.
And this?
Much less. I think we bring it for $400.
Oh my God.
So you're saving money, which obviously helps all of our insurance. You're saving the time so that you're able to do more procedures, I would think.
And the patients are just as well off?
If not better.
Because I'm going to be one of these patients. I need both knees done.
I'm looking forward to it.
You're up for the trial?
I like the no pain part that you mentioned there.
Well, the key is, again, I hate to keep going back to anesthesiologists, but they're so key to, the old days, we would just give you general anesthesia. We knock you out. Then we have to wait for you to wake up to give you pain medicine. And you're writhing in pain. Now there's regional blocks, locals we inject into the knee.
Those catheters that they get to take home with them?
No, we don't have to do those anymore because of the risk of infection. But yeah, in shoulders, yes, but not so much in hips and knees. But I might rethink that. So that's the technology that allows me to do it. Now, Linda, we're probably going to do both your knees at the same time. We're going to do you in the hospital. You'll both knees are going to be more cumbersome for you. You're going to have a little bit more blood loss. But the reason I bring that up is you'll still benefit from all this technology. Just because you're not being done outpatient doesn't mean this doesn't come for you.
It's probably because I'm 80 years old. That's probably.
I don't believe it.
When can I come back to work?
Bilateral knees, I would say a month.
A month.
Yeah.
So
I'd rather promise longer and get you back
Let me ask about that. So we have all these different technological advances, but the body still only heals so fast.
Correct.
Is that something you are having to explain to patients? It may be quicker and initially, but your recovery doesn't change?
Yes, but there's been technologies that have gotten better for that. We're now using, you hear all this stuff about stem cells and PRP, and let me give you a quick example. Stem cells, which we harvest from your bone. I got to drill a hole, I suck out the stem cells, and I hope, what is it? Is it blood? Is it stem cells? And I inject it. $8,000. An incredible cost for unknown benefit.
Okay.
Well, now we're taking the amniotic side of the placenta and the umbilical cord cells, the actual cells. That protein that they generate, we're using in an injection. It's reducing inflammation, reducing infection, and increasing recovery immensely.
Post-op.
Oh, wow.
Intra-op.
Intra-op,
During the
okay.
surgery. So you can use this stuff to avoid surgery. Athletes are using it more for soft tissue injuries. But, you know, in our conversation of total joints, again, it's all about increasing your recovery.
You know what I like about this, the takeaway? If something hurts, you can fix it. You don't have to
True.
live in pain. And we're going to tell Linda that every
Wait
day
till you see my new knee.
until she gets herself in there. If you have information about any orthopedic procedures and all the new things that are happening, you can get more information on Dr. Stolarski's website. Great to see you.
Yes.
Thank you.
Coming up
Thank you.
next, the holiday movies are coming out. We've got a preview.